So last month we saw a whole bunch of people to completely rebuild their smile, but there was three particular cases that come to mind, and they were all on four cases, and they were done completely differently. So these are the three cases. One was a standard all on four. So you can see this from the X-ray, where we've got this kind of orientation of implants. You've got these two straight ones at the front and then the two side ones that angled. And I'll explain why this is in a minute. So this is probably how 70 to 80% of all-on-4 treatments look like on an X-ray, because it's a really common bone pattern. Now you can see in this X-ray, the implants are angled very differently. In fact, the side ones are particularly long, and these are what's called zygomatic implants. Now, this is for a specific kind of bone pattern. It's a very specific situation, so it's not a very common implant to be placed, but for some people, this is the best solution. But then if we look at this X-ray, it kind of looks like the first one a little bit, but you can see that the side implants are much longer. These implants actually go through the sinus and engage in the bone on the side of the nose. So this is called a nasalis implant. And I'd say this is even less common than a zygomatic implant. And then we've got options of putting implants really far back, and these are called terragoid implants. Now, if we're strictly speaking, all-on-4 is a concept that was thought up by Nobel Biocare, which is a well-respected implant manufacturer. And really, it's using their implants, it's using their treatment protocol to give the patient a full set of fixed teeth in one day. And I think this is the real draw to patients, to have all of their dental problems fixed in one day. And it makes it really easy to understand from a patient's perspective if to solve all your problems, all you need is this one product called all-on-4. But in this video, we're going to go through a whole bunch of variations on this all-on-4 or teeth in a day. A lot of people are calling it all-on-X because it doesn't need to be 4. And I want to show you how this treatment is customizable to each and every patient. You see, at our practice, we don't specialize in one thing. Okay, that would mean that everybody who comes in is treated in exactly the same way, in exactly the same protocol. And we don't have that. All our treatments are completely customized to the patient, and that's why there's so many variations here. So let's look at the most common first, okay? And this is the first example that I showed you. And in all of these examples, I'm mainly going to be talking about the top jaw because that is a little bit more complicated than the bottom. The bottom is a little bit more standardized. So we've got these 4 implants, okay? And if we look at a basic level X-ray, we can see that here we've got the bone in this kind of trapezius shape. Up here, we've got the air sinuses, okay, and we don't want to put our implants directly into the air sinus. So in order to get the implant head position as far back as possible, what we do is we often angle the back implants, and that's why things look the way they do on the X-ray. At the front, usually there's enough bone. Now, we often split up this X-ray into zones, okay? So we've got zones 1, we've got zone 2, actually it's only one zone 1, then we've got zone 2, one on each side, and then we've got zone 3. Okay, zone 2 is really where the premolar teeth are, and zone 3 is where the molar teeth are. Now, a lot of people are surprised to find that usually with an all-on-4 treatment, we only restore up to the last premolar. So you have 5 teeth either side, so 10 teeth. And the number of teeth isn't really important. What's more important is the amount of chewing teeth you have available, or the chewing area that you have available. So usually we'll make the back tooth a little bit bigger to look like a molar, even though it's a premolar. But this number of teeth is really there because of the bone availability. You see, remember I said about 70 or 80% of people fall into the kind of the main category of all-on-4, and that's because they have bone in zones 1 and zones 2, and we can place angled implants because the shape of the sinus is pretty typical, and it allows us to do this. Now, not everybody falls into that category. So for example, the shape of the sinus could be different. And if the shape of the sinus is a little bit more angular, then we can't put the head of the implant at the kind of the second premolar position in that zone 2 area, even though we might have a little bit of bone there. So this is where our most rare kind of implant comes in. Okay, this is what's called the nasalis, and Not a lot of people do this implant. It's not widely available. Not every implant manufacturer will even make an appropriate sized implant. But because we've got this kind of like right angle of a sinus coming in here, what we can do is kind of bypass that sinus, okay? And what I mean by bypassing, I've got another video all about sinus lifts, but really a sinus is a hole in our bone, which has got this kind of membrane on the inside of it, okay? So if we lift that membrane up, we can actually go through the sinus and not interfere with the sinus. I know the word sinus puts a lot of people off, okay? But it's usually because they don't understand everything that's involved with it. But what this implant lets us do, again, is to engage in good, healthy bone, okay? It's a little bit further away than where we would normally go. And it allows us to have that head of that implant coming out in a nice position quite far back. And that gives us this thing called AP spread. Okay, AP spread is anterior to posterior spread. So if we look side on and we have a good distance between the front and back implant, that means our final bridge is going to be more stable. But in some cases, what we'll find is that some patients don't have any bone at all in zone 2, okay, and very little in zone 1 as well. So in these situations, we've got options. We've always got options. We could either do sinus lifts to increase the bone in our sinus, and we could place just standard implants. Okay, this is a really beautiful solution, but it's not so quick, and that's why a lot of people don't go for it. But there are definitely situations where this kind of solution is better. The quick all-on-4-esque solution is to use zygomatic implants in this situation. So again, we're doing that same technique of kind of bypassing the sinus, but we're using bone which is much further out. We're using our cheekbones. And this is a very predictable treatment. It's great for those situations where we've got these massive air sinuses and no bone anywhere else. So we can combine it so that we can have standard implants at the back and zygomatic implants at the back, but sometimes we're in situations where there's hardly any bone at the front as well. So we have to use 4 zygomatic implants. This is called a quad zygo. It's quite an advanced technique. See, all of these techniques, the nasalis and the zygomatic implants, are pretty advanced. So a lot of places might not offer them, or they might say, hey, look, you can have it, but we need to get somebody else in to do it. And that's a great solution because you want to have somebody who is experienced to be offering this kind of treatment. Now, the other implant which I mentioned, the terragoid implant, which goes really far back, that's not really solving the problem of we don't have bone in kind of zone 2 and zone 3 area. What that really helps us do is I use it in 2 situations. Number one, where the patient has a really wide smile. So we've all got a different smile. When we smile, we show different levels of gum, we show different side teeth. And what we don't want is that if we're not putting teeth really far back, we don't want there to be a visual gap. Because a lot of our patients come in because they hate the appearance of their smile. They hate that they're not able to eat the foods that they want. They're avoiding social interaction. So we need to make the final prosthetic, the final teeth, look as great as possible. This is what makes that treatment a life-changing treatment. The nitty-gritty of where we put the implants and stuff, that's really my problem, and it's not the patient's problem. My goal is to really help the patient in the rest of their life, okay, and not to kind of have a nice picture that I can post on Instagram so all the other dentists who follow me are like, yeah, that's really cool. So my point is, these are all strategies to get us to the end result. And when I'm having a conversation with my patient, really understanding that end goal, that's what 80% of our consultation is about. Now, if we forget about the actual implant placement, we've got other variations on all-on-4 as well. So you could have teeth which are fitted right next to the gum. Okay, so this in technical terms is called FP1. And I've done videos on this in the past, and a lot of people have said, yeah, I would only want FP1. The truth is, just like the position of the implants, we have to look at your situation and the amount of bone you have available and what is achievable in your personal situation. And this is where customized treatment plans, understanding your needs, your goals, your end objectives, that's where this really comes into its own. And this is why we spend 2 hours with every new patient who we see. There's a lot to go through, even though initially you might think, oh yeah, all I want is all-on-4. We have to discuss all the variations on this. So I do agree that having just implant teeth against your natural gums is a really elegant way to do this. But I'll be honest, for all of the patients who we see, it's just not possible. Okay, so some people do something like this, and it's called an FP2, which is essentially the same thing, but having really long teeth. Okay, so this is our problem. As soon as the teeth come out, the bone shrinks up. As soon as the bone shrinks up, the gum shrinks up as well. And that's what makes these FP3s, which is fake gums on the final teeth, that's what makes this such a popular treatment option. Number one, technically, it's way easier to do an FP3 than it is to do an FP1. If we're going to maintain your natural gums and get a good gingival architecture, it's going to require tissue grafts as well as maybe tactical implant placement. So sometimes we don't do it all in one day. Again, it's really patient focused and really understanding what is possible in that situation. But for an FP3 where we've got the fake gum, okay, we don't need to really think about it in that much detail. Okay, and that's why there's so many places which are just doing all-on-4. What they're doing is these FP3s, and you know what, 70 or 80% of the cases this is a great solution. Now, as a dentist and in these videos, I've got a tendency to go really detailed, and the truth is, whenever I'm making a big purchase, I will spend hours or days, just researching stuff on YouTube, just finding all different opinions from different YouTubers, all about all this stuff, which in reality doesn't matter. Because what really matters at the end of the day is, what is this treatment going to do for you? Okay, what is it going to let you do? So the extreme before and afters that you see on my Instagram, they're not situations that suddenly the patient wakes up and, whoa, okay, my teeth look like this now. This has happened over a long time. These are complicated problems. And the effects that they have on our patients range, okay? Nobody wants to smile. Everybody has a kind of a lack of confidence because of the appearance of their teeth. Even the rock solid house builders who come in and they'll tell you that the appearance doesn't matter, right? It always does. We can see it in our before and after photos. We can see it in the way that the patients come in initially to how they are, even when they just have their temporaries. Okay, it is life-changing. You feel great about it at the end of it. But also, it allows our patients to eat and not avoid going out or avoid social interactions. And I'll be honest, all-on-4 is not the only treatment that's going to let you do this. My next video is all about the other options. Options which are kind of sometimes overlooked, options which are less trendy these days, but these options have really, really big advantages. So if you want to watch that video, remember to like and subscribe to the channel. It really helps the channel out. But also, you can sign up to my email newsletter. It's something which I write. I don't outsource it to anybody. It's all about the stuff which is going on really in our clinic, treatments that we're bringing forward. And it's just got additional information to these videos, and you can always contact me directly via that as well. So link to all of that is in the description below. I hope to see you in the next video, guys. Take care.